Need to get some rest. This is the worst headache ever.
Right arm's all tingly all of a sudden. Must have slept on it last night.
I keep losing my balance. These old bones need some exercise.
Granddaddy, what you just said doesn't even make sense. It sounds like gibberish.
Signs like these could be more than what they seem. They could be a sign of stroke.
Sudden weakness or numbness of the face, arm, or leg.
Sudden trouble with vision in one or both eyes.
Sudden trouble walking or difficulty with balance.
Or a sudden intense headache that comes out of nowhere.
If you or someone you know has any of these symptoms, don't wait. Call 911 immediately. You could make a difference in someone's life, someone you love, maybe even your own.
Time lost is brain lost.
Find out more at powertoendstroke.org. Brought to you by the American Heart Association, American Stroke Association, and the Ad Council.
The following programming is furnished by you and your doctor.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Good evening, my friends from Florida and around the country. I hope you all had a wonderful, wonderful 4th of July weekend. You're all healthy and back to work. We have a very special guest tonight. We're trying to get him on the phone right now. He's away on vacation, but thank God he at least gave us a call in. And I think you're going to appreciate what he does. It's Dr. Jay Seidel. Dr. Jay Seidel. Jay, how are you doing tonight?
Fantastic. How are you today?
I'm doing wonderfully well, thank you. Can everyone hear Jay? Jay, can you speak a little louder?
Sure.
Okay. Now, Jay is a fantastic podiatrist. His office is in Hillsborough Boulevard. Jay, tell us a little about your training, where you got your training. I'm looking at it right now, and it's a great resume. I know I went to you myself personally. I love the service you gave. And you got a great staff over there. Tell us where you're located, your phone number. Tell us a little bit more where your training started.
So I practice currently in Deerfield Beach, the corner of Hillsborough and Military. It's 1874 West Hillsborough Boulevard, Suite F as in Frank. And we've been there for almost 4 years already. I've trained in Harrisburg, near Hershey, Pennsylvania. And I went to school in Temple University in Philadelphia.
You also did
the phone number for our office is 954-426-4544. You can also find us online at southflpodiatry.com.
And Jay, you also did some training at Cleveland Clinic, didn't you?
That's right. I did some advanced training for microsurgery in Cleveland.
Well, you know, the study of podiatry, people say, well, what is a podiatrist? What does a podiatrist do? Jay, tell us exactly what podiatry is. What do you do for the patient? I know I went in to see you, and you looked and examined it. I understand it's from the feet up to the knees. Is that correct, podiatry?
That is correct. Anything below the knee is fair game. We treat skin, we treat muscles, we treat tendons, bones, any type of problem you may be having with your feet, ankles, or lower leg, whether it's a diabetic wound, whether it's an ingrown toenail, whether you need orthotics, or you need your nails cut, whatever it is, we can definitely help.
And I think one thing, people don't realize how important the feet are until something happens. So basically, what are some of the things that you really look at, Jay, that, people come into you for? Is it they come in for neuropathy, diabetics? Tell us what the services you can provide. Somebody says, oh, Doc, I can't feel my feet, they're tingling. What's some of the causes for that?
So neuropathy can be caused by a couple different things. Diabetes is the primary cause. Alcoholism is another cause. Some diseases also can cause lack of feeling or even burning or tingling or stabbing pain in your feet. A couple different treatment options include medications. You could take oral medications that can help relieve some of the symptoms that you're having, some of that pain. Different types of injections we do, and sometimes it may even require surgery to fix the underlying problem that's causing that burning, tingling, or numbness in your feet.
And one of the other things I do, my mom, she had diabetes, and she would always go to podiatrist, basically have diabetes, to have her nails cut. So you will even do simple things like cut your toenails. Am I correct?
Absolutely.
Now, why should a person come in if he has diabetes? He says, I'm going to try to cut my own toenails. Why should he use a podiatrist to cut their toenails?
So oftentimes people with diabetes will have decreased feeling in their feet, neuropathy, or they might even have decreased blood flow to their feet, which is called peripheral vascular disease. And when you have decreased feeling or decreased blood flow, your potential for healing is diminished. So if you were to cut your own feet, and everybody knows it's hard to reach your own feet, and you were to cut the skin inadvertently, that could lead to an infection or gangrene or an amputation. There can be a lot of bad outcomes for taking care of your own feet. So it's best to allow a professional who has training, and also we can just reach a little bit better. And we're happy to do it. I would say most of the time the insurance even covers it because, and it's difficult to reach it yourself. And if you have any of these underlying medical conditions, the insurance company will pay for you to see your podiatrist and have them take care of your feet.
Now, as far as when you treat basically from the feet to the knees, sometimes people end up with bad ankles and need ankle surgery. Do you also do ankle surgery in some situations?
Yes, we do. That's definitely something that we can offer at the office. People that have had a bad injury or if they had a chronic problem that started to get worse and now is causing pain, there's many treatments that we can do in the office. And then as a last resort, surgery is definitely an option.
Okay. So now Jay's number, if you want to call for an appointment. Now, do you take walk-ins too, Jay?
We definitely do.
So he takes a listen. If you go by Hillsborough, there's a lot of people down there. Matter of fact, he's right close to Century Village, not too far from Century Village. His office, I believe, is in the back of. I think it's off of Hillsborough Boulevard. Correct, Jay?
Yeah, the shopping center where there's the CVS on the corner. We're all the way in the back.
He's got a CVS on the corner. He's all the way in the back. They're right next door to a real estate company, so it's easy to find. Just drive around the back, and you'll see podiatry. And Jay takes in walk-ins, but if you want to make an appointment with him, you call 954-426-4544. That's 954-426-4544. And I tell you, he'll get you in right away. If you have an emergency, he'll get you in right away. And it's a very clean office. I visit the office myself, and he's excellent right now. Jay, you're away on vacation right now, aren't you?
Yeah, but my partner, Dr. Stephen Schwartz, is there in the office. He's fantastic, and he's happy to take care of any patients that need care.
Now, when will you be back, Jay?
I'm coming back in the middle of August.
He'll be back in the middle of August. He's away with his family right now. He's doing this show. Thank him for having him on the show. Now, he belongs, professional organization, some of the things he belongs to the American Pediatric Medical Association, Maryland Pediatric Medical Association, American Pediatric Surgeons. He does a number of things. He has publications. He's written some articles. Tell us, Jay, what would people come to you for? What are some of the signs that they would say, gee, I got to see a podiatrist? What signs would they basically have to come to see you? Would it mostly be neuropathy, mostly be pain in the feet? What would it be? Wounds that they see?
I would say the number one cause of someone visiting my office is pain. If someone's having pain in their toe or pain in their ankle or their lower leg, or sometimes people even come in if they're having back pain or neck pain, because your feet are your foundation. Just like if your house foundation is crooked, your whole house is going to be crooked. So if your feet are having trouble or something's wrong, it can affect your whole rest of your body. So we've had definitely patients come in with foot or ankle or toe problems, and also patients coming in with knee problems, with back problems. They want advice on what shoes to wear, whether they need a pair of orthotics, or if they have an infection in their toe or their leg. We see a wide variety. And the nice thing is we treat everybody, whether it's a young child or whether it's an older person. We take care of from birth to old age. So we really have the capability to provide any type of services for your foot and ankle in the office, which is really nice. One-stop shopping.
Okay, now, Jay, this insurance now, This insurance is covered by Medicare and Medicare Part A, Part B. Also, do you take any other insurances?
We take almost every insurance. If you check out our website, there's a complete list. Again, that's southflpodiatry.com. But we take Blue Cross, Cigna, United, Aetna, Medicare, Medicaid, Preferred Care Partners, Care Plus, Humana. We take the new insurances that are on the market now. We take Bright Health. We take Oscar. We take Devoted. We take AvMed. Pretty much everything. And even if we don't take your insurance, we're happy to work with you and come up with a reasonable cash price so that you can get the medical care that you need. One other thing that's really nice that we offer is we participate with some clinical trials. So even patients that don't have any insurance whatsoever and don't have the means to pay cash, sometimes we can provide cutting-edge medical care using money and sponsorships from drug companies. So we can provide that care to you, and there's no out-of-pocket cost, and sometimes you can even get paid to participate in these clinical trials.
So what are you doing presently, are you doing any clinical trials right now?
Currently, we're doing one clinical trial. It's for leg wounds and foot wounds. So if you have an opening in your skin on the foot or on the leg, you definitely might be eligible to participate in the clinical trial. And we can definitely provide fantastic care, again, cutting-edge care that's not even available to the regular person through insurance yet because it's not on the market. We're doing pre-market research. So definitely give us a call if you have an opening in your foot or on your leg that hasn't been healing well, and we can see if we can get you qualified for the clinical trial.
Let me try to explain that to our listening audience. Jay is saying to you right now that you could possibly get paid. They're doing a clinical trial, and I don't know what phase they're in, but it has a number of phases. And Jay's doing a clinical trial on wounds, on wound care on the leg. So that means if you don't even have insurance, but you think you got a wound that maybe that could basically help Jay with these clinical trials, you can go in there, ask to be one of the participants in a clinical trial, and receive the care, and might even get paid for it. Am I correct, Jay?
That's correct.
Now, where can you go there? Don't pay the doctor, but they'll pay you, basically, to treat you if you don't even have any money. So Jay does it all. He basically has a tremendous amount of following because he has all the insurances that are necessary. As I said, he's right near Century Village. He has a lot of those patients from Century Village that walk over there for years. And right now, Jay, we're going to take a little 30-second break, have a little commercial so we can pay for this time that we're on. And we'll be right back with you. Don't hang up, Jay. We'll be right back with you.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. Patient's needs first. So if you believe you can or believe you can't, what do you believe? Who is the only person who stops you? You. If you're not moving forward in your life, either personal or business, then it's time to shift your energy, releasing your negativity and stepping into your positivity with strength and confidence is your freedom to experience your goals and visions that have been waiting for you. Let's shift your energy with Lorena Anderson's proven and powerful skill set so that once and for all, you can live your dreams. Call Lorena at her office, 954-647-5525, or email her at lorenaanderson@gmail.com. All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back, folks. We have Dr. Jay Seidel, a podiatrist located in Deerfield Beach in Hillsborough. Jay, are you with us?
Still here.
Okay, that's great. Now, listen, folks. People say podiatry. Jay tried to explain to you what podiatry really is. Podiatry, you know, like he said to you, your feet are basically the base and your function of your whole body. If your feet aren't working properly, your body is going to be out of what I call out of sequence, or basically out of, you know, it's not functioning properly. So your balance is off, etc. Now, Jay, when a person comes and he has balance problems, do you solve anything for balancing for feet?
I'm sorry?
If a person comes and he basically has a balance problem, you know what I'm saying to you? Because his feet aren't functioning properly. Now, what would be some of the reasons why his balance is off?
Some of the reasons that I've seen in the past few weeks are a person has a limb length discrepancy. So if one leg is a little bit longer or the other leg is a little bit shorter, that can definitely cause an imbalance. If a person has some muscle weakness and therefore his ankle is not functioning properly because the muscles aren't working to move his ankle properly, that definitely can lead to an imbalance. Vision. If many times I've been the diagnostic points where a patient would be referred to an eye doctor because their vision's not great and they're tripping over things, and we've evaluated and ruled out any type of foot or ankle problem, but then we make a referral to an eye doctor and they can get their new glasses or get their eyes checked, and that can relieve their balance. Same thing with an ears, nose, and throat doctor. Sometimes imbalance is inside the head by the ears, the vestibular process. So if a person has an issue with their inner ear, that can lead to balance issues. And sometimes it can just be the wrong pair of shoes. They're causing a lot of pain, therefore the person's walking funny, and that's causing them to be unbalanced.
You know, Jay, my dad was a cobbler, a shoemaker, and he used to get a lot of prescriptions for people to fix their shoes, either raise the sole, raise the heel, because basically one foot might have been shorter than another, and the doctors would write a prescription to fix their feet through basically fixing their shoes that they wore. Now, do you find that is something common that you would give prescriptions as far as for shoe repair people?
That's definitely something we do. More often than not, we're able to fix the problem in the office. We have different types of pads and different types of braces that we can use to fix, but absolutely, we'll definitely bring in a shoemaker or a prosthetics lab to do something a little more custom if that's necessary. So, folks,
you might have a problem. You don't know if one foot is shorter than the other or one leg is shorter than the other. And what Jay is saying to you, he might have to send you to a simple cobbler can fix your feet. After Jay gives him a prescription, he can analyze your feet and decide what you might need as far as a shoe to fit you properly. So that's one of the things they do. I mean, they're all around. The factor is from the ankles to the knee, Jay can examine you. Now, Jay, sometimes I don't know if it's possible, but sometimes people could find like a cancer on a person's shin or something from the sun. Do you ever come across that?
Yeah, a couple times already here in practicing in Florida. It's definitely a lot more common because we're in the sun a lot more, and it's nice out all the time. But definitely, I've removed several skin cancers from patients' legs and their feet. Anytime you have a spot that is different in color, size, shape, or if it looks new, not something that's been there for many years, definitely something you want to get checked out with your podiatrist to make sure that you're getting ahead of the curve and it's not a cancer. And if it is a cancer, a lot of them are treatable in the early stages. So you definitely want to have it checked out to make sure that it's addressed before it gets worse.
Now, what would a skin cancer be? Sometimes the color could be white or be different color, correct?
Absolutely. It could be white, it could be black, it could be brown, something that looks different than your natural skin. Definitely there's a chance that it could be a skin cancer. Now, what we can do in the office is we take what's called a biopsy. We take a little piece of that spot, and we can send it to the lab, and they could check it out underneath a microscope and determine if it's a cancer or not. And based on what their recommendations are, we determine if we need to use like a topical treatment or if it needs to be surgically removed.
Okay, that's great. So, folks, if you see some discoloration on your legs, that could be, again, a skin cancer that Jay could treat right in his office. And it's, you better get it done earlier than later because, it can amount to something serious. Jay, what are some of the other things that you think are common to our senior citizens in Florida that basically they would come to see you for, that they really don't know should they come or they shouldn't come?
Any problems with your toes or your toenails? We see many patients that have real thick or discolored toenails caused by a fungus. That's definitely something that we can help them treat and help those nails get back to their normal appearance, and also to help remove them or debride them, which means to kind of come down so they're not real thick and painful in your shoes. Another very common ailment that we see is ingrown toenails. So it could be that the nails are real thick and they're growing into the skin, but even people that have nails that are not real thick, sometimes if they're cut funny, I see a lot of patients that go to a nail salon and they'll get their nails polished and cut, and if they cut them at an angle, it can grow into the skin and become very painful and even infected. So that's something that we see a lot in the office to remove ingrown toenails. We definitely can treat that.
The other thing I hear a lot about are these things called bunions. What's a bunion?
A bunion is a bump on the side of your foot, on the inside where the big toe joint is. Sometimes the big toe joint sticks out to the side, and the big toe starts leaning towards and maybe even pushing up against or underneath the second toe. So that deformity is sometimes caused by shoes or activities, but a lot of times it's genetic. So if your mom or your grandmother or your aunt had a bunion, there's a good chance you may have a bunion as well. Different types of shoes can help alleviate some of the discomfort, and sometimes orthotics can help keep it from getting worse. But every once in a while, surgery is required to repair that bunion. And the nice thing is that in the office now, we offer what's called minimally invasive surgery. We can make an incision that's very, very small, less than half an inch, to fix that bunion. And the nice thing is the recovery period is very short. I've had many patients come in and tell me they've gotten an opinion for bunion surgery and they're going to be stuck in bed for 6 weeks and have tremendous amounts of pain. When we do these minimally invasive surgeries, patients are walking the next day. They have no restrictions on their activities. It's a really great procedure that fixes the problem and allows people to get back to their daily life. And my threshold for surgery really is daily pain. So if you're a walker and you're not walking as much, or you don't want to go to the supermarket and go shopping because you're having foot pain because of your bunion, definitely you should give us a call and we can do an evaluation, get some x-rays, and see if you would be a candidate for the minimally invasive bunion surgeries, fix the problem and allow you to be pain-free.
So hear that, folks? I mean, a lot of people, I hear this, a lot of women have bunions. I think a lot of men have bunions too. And he can fix it by a minimum invasive surgery. You're up the next day. Now, that's worth, if you have a bunion right now and you want to talk to Jay, just give him a call. I'm going to give you his phone number again. Walk in to see him. His phone number is 954-426-4544. That's 954-426-4544. Jay, I understand some people that have diabetic. I was interviewing a gentleman for a position the other day in my company, and he said, these are diabetic shoes. What do you mean by diabetic shoes?
So diabetic or orthopedic shoes are usually a little bit wider and a little bit deeper, so they can accommodate different deformities that are caused by diabetes. And a lot of the insurance companies actually cover these shoes in some custom inserts once a year because they've done the research and it shows that wearing diabetic shoes can actually prevent wounds or amputations or other types of injuries to your feet. So the insurance companies feel it makes sense to pay for a pair of shoes instead of paying, God forbid, for a hospital stay or an intervention or a surgery later on down the line. So Medicare started the program, and a lot of the insurances followed Medicare, and almost all insurances now will pay for a pair of diabetic shoes once a year.
They'll pay for one pair or two pair? Jay, they'll pay for one pair or two pair of shoes?
One pair of shoes per year and several pairs of inserts. Usually 3 pairs of inserts go in the shoes.
Well, that's fair. So, folks, if you are questioning whether your shoes are too small or too fat, I mean, you see this ad with Skechers. I mean, they put all this wideness stuff on. Well, listen, you can go down to Jay, let him look at your feet. You might need a pair of what I call diabetic shoes, preferred shoes that Jay can fit you for, and you don't have to pay. It's once a year. Medicare or your insurance will pay for these diabetic shoes. And I asked this gentleman, well, are you walking better with the diabetic? He says, without these shoes, I couldn't walk. So it's a great, great savings, and I didn't realize there were special shoes for diabetics. So if you're a diabetic and you don't know about this, go down to see Jay. He's a podiatrist. He'll determine whether you can get a free pair of shoes or not from their insurance company. So, Jay, we're going to be off the air very shortly, but if there's anything you want to say ending this conversation, please tell me right now what you would like to say to our people out there that are listening. Now, how important it is to get your feet serviced on a monthly basis, bi-monthly.
It is super important to get your feet checked out on a regular basis to see your podiatrist. It can prevent a lot of potential problems down the road, and we can definitely help out with any existing problems that you have. One other thing I'd like to add is that we recently added a physical therapist to our office. So now it's one-stop shopping if you need some physical therapy services. It doesn't have to just be for your feet, but he covers the whole body, but it works really well together with podiatry.
Jay, again, thanks for coming on. I'm sorry to bother you on your vacation, but enjoy the rest of your vacation with your family. Hope to see you in the mid-August when you get back. I know Peter's looking forward to seeing you.
Thanks for having me, Larry.
All right, guys. Be good. Have a good night. Thanks a million. Enjoy your weekend coming up, and be safe. And if you're going on vacation, be careful and make sure you got enough gas in that car.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed